All right. Well, thank you for being here, everybody. My name's Emily. I have the privilege to serve in communication at Kadlec. And today's an important day. We've got a small but mighty crew here to talk about a really important subject, and that is stroke. And the goal today is, it's Stroke Awareness Month, but the goal today is really to let the community know about the signs and symptoms of stroke, what to do if they or someone they know or love is exhibiting signs of stroke. And we've got a really great expert panel to share some important information. So this morning you are going to hear from KAYLYN WYATT. KAYLYN is the neuroscience stroke coordinator at Kadlec. You'll hear from Andy SABIN. He is the medical officer with Richland Fire Department. Richland Fire and Kadlec have a very, very strong, long-standing relationship and work really hard together to take care of the patients in our community. And you'll hear from Dr. Sarah ATWAL, who is a neurologist with Kadlec Neuroscience Center. So I'm going to invite KAYLYN now. Thank you, Emily.
Hello, and my name is KAYLYN, and I am the neuroscience stroke coordinator here at Kadlec. And I'm here to talk to you a little bit about our program at Kadlec and what we do with the community, as well as what we do internally to encourage our population to seek help, or encourage our community to seek help whenever you do see signs and symptoms of a stroke. And then if there is something that we can do to research better practices, best practices, how we can incorporate those into our daily work and make sure that we are doing everything that we can for the community to be ready if somebody has a stroke, so that we can help in expediting their treatment and their care and then transitioning them to the community and back to home. So one of the things we do here at the emergency department is in triage, we teach our nurses how to identify a stroke using BFAST. BFAST, and you'll probably hear that mentioned again by my other counterparts here. B is for balance, it's balance instability. E is eyes, if you have any eye deviation or loss of vision. F is face, so a common thing is facial drooping that you may have heard of before. A is arms and legs, actually. So if you have numbness or tingling in an arm or a leg, or loss of muscle motor control in a limb, then that can be a sign of a stroke. S is for speech, speech in either understanding or speaking. And then time. So we really work closely with the EMS agencies in the area to get the emergency services up and ready, prepared to respond to a patient with a stroke, and then to communicate to our emergency department and the caregivers there how we can help take care of that patient. And they call in advance. They usually do what we call a stroke team activation out in the field. So they'll let us know that they found somebody that may have a stroke. They'll call in and let us know that that patient will be coming to the hospital. And that sets up different things in the hospital for us to do, like clearing out our CT scanner, which is a brain scan machine. Allows us to identify what type of a stroke the patient may be having. And then that sets up a different series of events so that we can treat that patient appropriately when they arrive. And emergency services is taught or encouraged to bring a patient straight from the door back to CT so they can get that patient that imaging as quickly as possible. And then we also move the patient through the different areas within the hospital based on that need. So if they've had a full stroke and if we can definitely do the best that we can to care for them here, we do that. And we really try to keep people close to home and not transfer them to other locations, and really try to do the best we can to keep people close to their families and serve who we can in the community. So I am going to introduce Andy SABIN. He is with the Richland Fire Department, Emergency Services, a medical officer there, and he's going to talk a little bit about what we do out in the field.
Thanks, KAYLYN. So like KAYLYN said, we do the same things out in the field as far as the BFAST and being able to take what we have and move it into getting that person prepped and packaged for the hospital. So like KAYLYN said, and we really want to pound it home, that BFAST is what we're looking for out in the field. So we're checking people's balance. If they're off at all, we want them to tell us if they're having any visual disturbances with their eyes, blurriness. Face, for facial droop, we're checking that as well. And we want to check their arms, their legs, to see if there's one side that's weaker than the other. And speech, The person might not be able to speak at all, but they still understand us, or they may have garbled speech where we don't know what they're saying. And then T stands for time, which is where we are trying to play a vital role in. So if a person is having stroke symptoms within 24 hours, we can get them to the hospital and they can still perform certain interventions. And like KAYLYN said, we can do a stroke team activation, so we can get things set up so when we do get to the hospital, there is a treatment that patient's gonna get right away. That's one of the things that we want the public to know as well, is that we want you to call 911. We don't want you to try and drive yourself. We don't want you to go with a family member. We want you to call 911, let us come there, and that's what we're trained to do, and it's our pleasure to serve this community in doing that. And we can get that person to the hospital. They're ready for us. We take them straight back to the CT scanner where they can differentiate what it is that they're looking for. And again, I want to say thank you to Kadlec. We have a great relationship, and we work really hard to make sure that we're delivering the best care we can to our patients. And that's some of the work that we do, is making sure that our times are correct, that we're getting people there as soon as we can, and hopefully improving the outcomes of people's lives. That's all I have to say, and I'll introduce Dr. ATWAL here at the hospital.
Hello, everyone. It is my pleasure to be here, to be standing here to raise awareness about a disease that is highly preventable, stroke. In the US, a stroke occurs every 40 seconds. That translates into 800,000 strokes a year. Although the risk of stroke increases with age, it is a disease that can affect anyone, young and old. While most people won't die from a stroke, stroke is the #1 cause of disability in the US. So what is a stroke? A stroke is a sudden disruption of blood flow that occurs to a specific part of the brain, and as a result, that part of the brain is deprived of oxygen and nutrients. Now, if that obstruction occurs due to a clot in that blood vessel, then it is referred to as an ischemic stroke. And approximately 85 to 87% of the strokes are the ischemic type. Now, if the stroke is due to rupture of a blood vessel in the brain, then it is referred to as a hemorrhagic stroke. Now, in terms of, there are specific medical conditions as well as specific lifestyle choices that can increase the risk of stroke. Now, there are treatable medical conditions which can increase the risk of stroke, so I'll talk about those first. Those include high blood pressure or hypertension, diabetes, high cholesterol, carotid artery disease, heart rhythm problems such as atrial fibrillation, sickle cell anemia, and also specific sleep disorders such as obstructive sleep apnea can also be risk factors for stroke. Now, specific lifestyle choices can increase the risk of stroke as well, and those include smoking, sedentary lifestyle or lack of exercise, diet high in saturated fats and sodium, recreational drug use, including marijuana, and also alcohol consumption. So what can you do to lower your risk of stroke? There are some healthy habits which can significantly reduce your chances of experiencing a stroke. So what are they? #1, see your primary care physician, primary care provider at least once a year, and get screened for conditions, vascular risk factors or stroke risk factors such as high blood pressure, diabetes, high cholesterol. If you have been diagnosed with high blood pressure, you should check your blood pressure regularly at home to ensure that the medications that you are taking are effective and keeping your blood pressure down. If you have been prescribed medications for conditions such as diabetes, high cholesterol, also high blood pressure, then ensure that you take those medications and don't miss any doses, please. Also avoid smoking, and if you need help with quitting, you can certainly seek the medical attention of a provider. Eat healthy, reduce consumption of foods high in sodium, saturated fats, and added sugars. Exercise. Try to aim for 30 minutes of exercise 4 to 5 times a week. And then also exercise and eat well to maintain a healthy weight. And finally, keep your stress levels down. Now, I would like to conclude by discussing stroke care available at Kadlec. As I'm sure all of you are aware, Kadlec is a stroke center and offers a multidisciplinary approach to stroke care. Stroke services at Kadlec include a stroke neurologist, available 24 hours, 7 days a week via telemedicine, who works with the emergency room providers to assess patients for ischemic stroke and specific clot dissolving medications such as tenecteplase. These neurologists also work with the ED physicians to assess these patients for catheter-based procedures such as endovascular procedures. Now, additionally, vascular surgeons, neurosurgeons, and interventional radiologists are available at Kadlec to provide both surgical and endovascular procedures for stroke. Thank you.